So you use my tissues, my blood, adipose tissue, and bone marrow, rather than an external source. And I know that that was one of the other things that I read, that a lot of people do use an external source. Why don't you?
Yeah, it's a good question. I actually used to. I used to use an amniotic product. This was probably 6-7 years ago. The company even flew me down to their facility in Scottsdale, Arizona. I did a whole tour. I met their chief scientific officer. They showed me all these flashy PowerPoint presentations of all these cells and things like that, right? But I started to question about how these things were processed and how these cells were able to still be viable if they had to be like cryo-frozen, or if there had to be a sterile process, right? Because it's from somebody else's tissue. You have to make sure that this is sterile if it's going into a different human, right?
Yeah.
And I started researching that and thinking, these are probably not viable cells.
Yeah.
So I actually interacted with one of my fellow colleagues in California. His name's Alberto Panero, and he ended up actually publishing a study where he got his hands on, I think, 6 or 7 amniotic, placental, umbilical cord type of products, basically products that are external sources, and tested them all and found that none of them had viable cells. So all of these companies were
and expensive.
They were very expensive.
Yeah.
We're campaigning and marketing that these are viable stem cells, and you get a whole bunch of them because it's from a very young source.
Right, better young than old.
Exactly, exactly, and it just wasn't true.
Yeah.
And then they kind of shot themselves in the foot too, because a few of these companies ended up having pretty bad infections in patients, and the processing that they were going through was questionable. So now the FDA has regulated pretty highly in these companies, and they essentially have to apply as it being a drug, which, as many people know, is a very extensive and very expensive process that a lot of these companies are just not capable of going through.
Yeah.
So I'm not saying right now that that's never going to be an entity. Like there's still some substances that we can get on the market, but there's going to be a much more rigorous process for them to go through before they are applied.
Okay.
But to be honest with you, even if that's an opportunity, right, I use it very selectively, because almost inevitably I want to go for the patient's own product before I go with that. And the reason being is that we know from the research studies that a lot of these cells have these little signaling arms, is the best way to think about it, that communicate when they come in contact with other cells or other tissue types, and they communicate with the substance that they swim around in.
Yeah. And
And they found that those little arms that communicate are better with communicating with the own body than with an external substance, essentially.
Yeah.
So that's what we're trying to bank on, right?
That
Let's
makes
give the
sense.
body the best
So the whole
opportunity.
thing about, like, for instance, the bone marrow, the VMAC,
Yeah.
for me, I'm
Yeah.
older than, like, if we were to get a little baby, it doesn't matter.
Yeah.
This is going to be better.
Right, and you can imagine too, there's also some idea that the closer you get your cell substance to the type of injured tissue that you're hitting, as in bone marrow to bone disease,
Yeah.
there seems to be a better communication process. And so when I'm talking about these kind of external source products, you're talking about amniotic tissue or fluid, right?
Yeah.
After a healthy woman has a delivery, they will take the placenta and they'll actually break down the amniotic product, and that's what you get delivered. There's some people too that will take the umbilical cord blood, which it has a high amount of stem cells in it,
Yeah.
and then process that. But again, you can imagine that source is drastically different than the type of tissue that we're trying to treat.